Myself, Dr. Sandeep Singh Sarpal. I'm a practicing physician at Dr. Kalra Clinic, Kharad. So today, I'll be talking about identifying the key risk factors of GERD in patients with diabetes. Diabetes, as you all know, is a condition where there is increase in the level of blood sugars in the blood that we call as hyperglycemia. Now, insulin is a hormone that turns the sugar into energy for the body. In this condition, the pancreas, which is an organ which is located in our stomach or abdomen, either does not produce either insulin or stops producing it altogether. So GERD is one of the many complications which is associated with diabetes. The higher risk of GERD in patients with diabetes is often linked to how long they have diabetes. This increased risk is due to the nerve damage, as we call in our medical language, autonomic neuropathy, and stomach issues, that is diabetic gastropathy, that can develop over a period of time in diabetes. As a result, people with diabetes have a weakened muscle at the bottom of the food pipe and problems with movement of food through stomach, which often lead to GERD as compared to those who do not have diabetes. Another factor is the late diagnosis of diabetes. Most patients are diagnosed with diabetes very late, due to which, in some cases, the disease may progress fast and lead to the severe nerve damage and diseases related to stomach that is known as gastropathy. So, diabetes itself is a risk factor for treatment of GERD because it reduces the effectiveness of acid suppressing medicines, which are the main therapies for the GERD, and it also increases the risk of developing diseases such as Barrett's esophagus and esophageal cancer. Now, consumption of foods that are high in fat or spices and drinks that can cause disturbance in the stomach, such as coffee and tea, also increase the risk of GERD in diabetics. Now, the best way to manage the risk of developing GERD in diabetes is early diagnosis of diabetes and effective treatment of GERD in diabetics because the symptoms can be unusual or even absent, and the symptoms can be confusing also. Ideally, GERD should be diagnosed as soon as possible to manage it properly. It is advised for all of the patients to do a routine checkups and maintain the blood sugar levels within the normal range if you have diabetes to prevent or reduce the symptoms of GERD. Thank you.